Before accepting or rejecting the results of this study, a critical evaluation needs to be done. To begin with the negative evaluation, the researchers found that the effectiveness of LSD treatment varied significantly according to the personality traits of the patients. This significantly limits the way in which LSD therapy can be administered as a general treatment for alcoholism. The researchers also mentioned the significance that all therapists have first-hand knowledge of a successful psychedelic experience with LSD. However, it can be challenging to find enough experienced therapists who meet this criterion. The researchers were also very specific about the environment in which the sessions take place. This poses the problem of wasted resources if the therapy space was not used for any other purpose. Furthermore, a confounding variable related to taking LSD is the mild physical discomfort that may be experienced during the first 2 hours, which may negatively influence the patient's experience. Additionally, the effectiveness of LSD therapy in terms of abstinence was evaluated using 3 categories: much improved, improved and unchanged. However, the definition of these categories is not very clear, as there were no quantified measure of what the researchers considered as definite improvement in drinking habits. Finally, the researchers admitted that LSD is not a permanent cure for alcoholism, and other additional resources need to be used to support abstinence. On the other hand, there is a positive aspect to the use of LSD in the treatment of alcoholism. Firstly, a single dose of LSD can lead to abstinence in the short and medium term. These findings are further supported by a meta-analysis by Krebs and Johansson, where a single dose of LSD led to short and mid-term abstinence lasting 2 to 6 months. Secondly, unlike alcohol, LSD has not directly caused a single death by overdose. Whereas MacLean and colleagues did use high doses of LSD, the patients were accompanied by 4 therapists in a controlled environment, guaranteeing their safety. The high doses were needed to alter the patient's habitual frames of reference, which have initially induced the patient's problems, and often reinforce those same unfavorable patterns of thinking and feeling which constitute the patient's problems. LSD treatment, unlike other drugs that aim to correct biochemical imbalances in the brain, encouraged patients to have an increased self-perception and motivation to abstain from alcohol. Thirdly, LSD does not cause physical dependence. Psychological dependence on LSD varies greatly, but it usually is not intense. The thrill-seekers and nonconformists may enjoy the effects of these agents and may wish to repeat them, but if such agents are not readily available, these persons will either do without them or substitute with another substance. A minority of users may develop such strong psychic dependence on those substances that they wreck their careers by persisting in using the drugs despite strong social condemnation. Despite that, MacLean and colleagues used only a single dose of LSD, so none of the patients suffered from dependence, and if the administration of LSD was regulated, it is unlikely that patients would become addicted.
Created using Powtoon.